will just say that those of you who are located at UCSF and have on your calendar the implementation science working group meetings, these are mostly journal club, does happen every month, and I really apologize for the conflict. We did not intend to double book those of you who join those meetings, and we won't do it in the future. I can assure you of that. Lauren Sterling and I talked. So just FYI for those of you who would typically be joining those meetings, we won't double book in the future. There's that announcement. And let's see, I wanted Julia to just tell the group what we have upcoming for the QWG seminar series.
Yeah, definitely. So next two seminars after this, the first one will be in January 12th. And we'll be having a seminar on criteria for evaluating and justifying qualitative research methods in the health sciences. This is one that Kim and I have done in the past. And I know she and I are always both very open to any kind of feedback. So if you've seen that seminar before and you have ideas for, a different publication that you've seen come out that you found useful, or just any other feedback, just give us a holler. And then on March 23rd, we'll be very fortunate to have Michael Duke talk to us about how he goes about thematic analysis. And I believe, Michael, you'll be drawing from an example or examples from your own past projects. Is that correct?
Yes, that's right.
All right. Well,
thank you for reminding me about it. I totally forgotten.
Don't worry. We will not let you forget. Great. Yeah. So that's it, Kim. So a couple of good seminars coming up, hopefully.
Great. And then does anyone else have any announcements that you'd like to share? Please we'd welcome any announcements.
Hi, I can share one. Apologize for my froggy voice, but we had a really interesting discussion last time about kind of how qualitative interviews can impact us emotionally and the potential for secondary trauma. So we've been meeting with some people in my department, psychiatry and behavioral sciences, about some resources. I'll just put a link to a great set of videos that were developed during COVID in the chat, and I'll look out for a future email about some additional resources.
That's so great. Thank you, Meredith.
I know. Thank you so much, Meredith. Meredith reached out to me after that prior session where we focused on qualitative interviewing, and then had this provocative discussion about the impacts of certain interviews on us, and Meredith took it upon herself to try to secure some resources for us. So yes, thanks so much for mentioning that, and we will follow up with an email. So now let me get started. It's 10:08. So welcome to today's Qualitative Working Group seminar. This is a seminar series that's sponsored really and mostly by the Center for AIDS Prevention Studies Methods Core. Thanks, Rochelle and Stuart, for all of your support on the back end. Julia McCoy and I run the Qualitative Working Group series, handle a lot of the email, line up the seminars. Thank you so much, Julia, for everything you do to make this happen. So today I am so incredibly delighted to introduce you all, that's the word I'm looking for, to Sara Ackerman. And actually, Sara, I wrote a little, I had to write down my intro for you. So I am going to just read it. So Sara's an associate professor of social and behavioral sciences here at UCSF. She holds a Ph.D. in anthropology and a master's degree in public health. Please mute if you are not muted. Thank you. I love that combination, by the way, of PhD in anthro and MPH. It's a great combo. Sara's ethnographic research focuses on the translation of genomic technologies into the clinic, with particular emphasis on the social and ethical issues introduced by recent efforts to expand inclusion of disadvantaged and racialized populations in genomics research. So Sara co-teaches two courses for the UCSF Implementation Science program, the first of which is Community Engaged Research. She's just wrapping up the course right now. That runs in the fall quarter every year. and the Qualitative and Mixed Methods research course, which is held in the winter quarter. I'm also just going to note that Sara is really a highly sought after mentor for many case scholars around campus too. So she's in high demand. And Stuart, thank you so much for introducing Sara and I to one another just a handful of years ago. Sara and I, we hit it off immediately, fellow anthropologists, and we developed the Qualitative and Mixed Methods research course, and we've been really close colleagues and thought partners ever since then. And I just want to say, Sara, thank you very much for saying yes to Julia and I to come in and talking with us about this really important topic. I know that you have a lot on your plates, and I know that we're all really busy juggling things. So I want to say thank you to the audience for also being here as well. And Sara, let me turn it over to you.
Thank you so much, Kim and Julia, for inviting me. I'm going to share my screen. And while I do, sometimes it takes a little time for me to get my presenter view up. I just want to say thank you all for joining today. And I think what Kim said is all too true, that for some reason this fall feels busier than ever for a lot of us. And so hopefully what you can see now is in the presentation view. I have a bit of a funky setup here.
Yeah.
If not, let me know. So I'm going to be talking today, and this is a group that I think has a lot of knowledge about community engagement. So I want to just preface my talk by saying that I'm hopefully going to keep this to 30-35 minutes to give us enough time to actually have a conversation afterwards. And Stuart has graciously given us this meeting time until 11:10. So if anybody can stay a little later, please do. We'd love to talk with you. So I'm going to be talking about community engagement in health research and reviewing some of the popular strategies that are used and what their implications might be for scientific knowledge production. And I'm just going to give you a brief overview. I'm first going to talk about what do we mean when we say community engagement, some of the historical context and conceptual frameworks that can be helpful for understanding this domain. And then I'm going to go through a couple of approaches that you just hear about a lot lately, community-based participatory research and community advisory boards. This is barely scratching the surface of community engagement. But then I'm going to finish up by talking about some challenges and opportunities and other approaches that we can consider. So before I get started, Kim gave a really lovely introduction to me, and so really this slide is maybe not as helpful, but I want to just position myself. And first of all, to say that I grew up in San Francisco, and this is an image of one of my favorite parts of the city. And my graduate work was at the University of North Carolina in Chapel Hill. Like Kim said, I first pursued a master's in public health, and that's actually where I got my first kind of exposure to the community-based participatory research paradigm. I studied with Jeannie Eng, who has done a lot of work in that area, and she kind of just threw me right into a project in Eastern North Carolina, and that's how I learned how community engagement was done. And I went on to do a Ph.D. in anthropology, did my field work in Costa Rica, and working on my dissertation, I realized that a lot of the same sort of principles and practices inform both ethnographic work as well as what we call community engagement. So there really is a lot of synergy there. And so Kim summarized my ongoing research and teaching, so I'm not going to provide a lot of detail about that, but happy to answer questions later. I just wanted to say that my course on community engaged research, really, I feel like since I launched this course 5 years ago, I just feel like more of a student of community engagement than a practitioner, because there's so much amazing work being done out there. So let me just jump right in. This is how I understand community engagement, and this is a term that is vague in a lot of ways, but really what it means is involving patients, members of the public, and community-based organizations in research beyond simply being participating as research subjects. And I use the words participation and involvement down here as well, because I think that community engagement is a term that's very commonly used in the US more than in other countries. So if you look at the literature outside the US, you'll actually see terms like public participation, citizen involvement. I think these are all fairly interchangeable, but it's helpful to know a little bit more about the terminology across settings. So I think at the heart of community engagement is this idea of co-creation, moving from a more extractive relationship between researchers and participants toward one that is more reciprocal. So the idea here being that there should actually be mutual benefit to research on the part of everyone involved, and that people who were previously considered subjects can actually be part of this co-creation process. And co-creation means collaborating on the development of research questions, research tools, research knowledge, and in the case of intervention research, which I'm often involved in at working for the implementation science program, co-creating solutions. So this is a much more inclusive approach. There should be multiple perspectives included in community engagement. And there's also a strong emphasis on the importance of local knowledge and a sort of breaking down of previously sort of assumed clear distinction between expert and lay knowledge. So the rationale for community engagement, I think, is multiple, of course, but it really can enhance both the sort of relevance and impact of research, and meaning that we can focus on research questions and solutions that actually matter to people. I think it's also important for restoring trust and connection with communities that have been historically marginalized and even exploited by the medical system. And also we can really aim at addressing some of the sort of root causes of preventable diseases, and in so doing address some entrenched health inequities. And then finally, I think capacity building is a strong focus in community engagement. This is really looking at how do we develop the skills and competencies of community groups so that they can develop and implement their own solutions to problems that are important to them. So just a brief sort of historical context here. I think that some of the antecedents of community engaged research lie in the US labor and civil rights movements in which the principles and practices of community organizing were developed. This is really an arena in which people come together to identify shared problems and advocate for their interests. So if you're interested in the connections between civil rights and community engagement, in particular, the book that I've put a picture of here, it is very helpful. And so in the 1930s and 40s, social psychologist Kurt Lewin developed this idea of action research in which sort of ordinary people participate in social experiments in order to accomplish their own goals. And this kind of was transformed in the 1970s, especially in Latin America, into participatory action research, which is kind of a model for sort of collective inquiry used to counter oppression and create social change. And this was, I think, largely attributed to the ideas of Paulo Freire, Fals Borda, and others. And they strongly also emphasized this idea of local knowledge as an important form of expertise. I also want to mention the Alma Ata Declaration. I don't know how many of you are familiar with this, but in 1978, there was an international conference on primary health care. So it was kind of the first of its kind. And the conference issued a declaration underlining the importance of primary health care for everyone around the world. And it's something I think we maybe take for granted now. Primary health care was not available to most people then. And the declaration called out the structural causes of health inequities and also called on all people as groups and individuals to get involved in planning and implementing healthcare. They argued this was a human right and a duty. So I think it's also crucial to mention the histories and experiences of abuse and exploitation by medical researchers and institutions experienced by marginalized and racialized populations. I think this is a very strong impetus for engaging communities in research, but it also serves as a real barrier to doing this for understandable reasons. So I'm just going to walk us through a couple of frameworks that are used to help us sort of think about engagement and participation. And I think maybe the most famous, and this framework did not emerge in healthcare specifically, but Sherry Arnstein, she was a policy analyst and published this now pretty, famous, very often cited article about, she developed this ladder of citizen participation. And she really sort of put it bluntly, saying that, look, the first, 5 to 6 rungs of this ladder are basically ways of tokenizing and ensuring the non-participation of citizens in important policy decisions. And that only by reaching the higher rungs of partnership, delegated power, and control do we actually have true citizen power in important decisions that affect regular people. And this ladder kind of has been adopted and converted into this kind of more continuum focused a kind of metaphor here for engagement that maybe a lot of you are familiar with. This is from the NIH and CDC. It's widely cited. On this continuum, there's a lot of the same concepts as Arnstein's ladder in terms of moving from more of a one-directional kind of outreach type relationship between experts and community toward a shared leadership model on the right. But interestingly, the ladder, you can see the ladder has sort of been turned on its side and all mentions of power are gone. So this is interesting. And I also think that despite the attempt to sort of explain how engagement works or can be conceived of, there's still a persistent sort of lack of conceptual clarity around terms like engagement, participation, and what they actually mean. And I think one of the most important concepts, of course, is community. And what do we mean when we say community? I think very often we think of community as shared identity, social ties, maybe living in the same place. But of course, we all know that community membership is far more complex. It can be layered, it can be mutable. People belong to multiple communities and not always permanently. But not all of our memberships sort of work well together. And communities really they're not bounded or homogenous the way that this term often implies. So I think that the way we define community has some real ethical implications for who has a voice in research, the type of knowledge that's produced, and who benefits. So some key questions that come up are to whom, who is going to represent, first of all, the community, who speaks for the community, and to whom are they accountable? And what are the consequences if you decide to collaborate with, say, one group that claims to represent a community and not another? Are there voices that are left out? And then finally, what happens when, as I'm going to talk about community-based participatory research, where if participants become active in the research process, they're essentially becoming researchers. So this means that the roles of researcher and participant become blurred. What does this mean for our understanding of who counts as a community member and who counts as a researcher and status? So despite the continued lack of clarity around some of these key concepts, this has not kept community engagement from really taking hold in health research. It's really for a long time been a strong focus in public health research. But you can see in health research that this idea of community engagement is increasingly important. It's expected by funders, and it's been embraced by academic health institutions. I think this may be partly because of the rise of this idea of translational science, which is essentially sort of a call for a more efficient and effective translation of research knowledge into actual benefits for real people. So I'm going to go ahead and talk a little bit about community-based participatory research. And this is, I think, maybe the far right of that spectrum that I showed earlier, which is a true sort of partnership between researchers and communities. So it's essentially a collaboration in which community members are involved in all aspects of the research process. And this grew out of participatory action research, has a strong foundation in public health. And you can see through in the two books that I have here, these are so they're sort of grandmothers of CBPR from public health. And they're often kind of formed through coalitions of community-based organizations and academic institutions or researchers. So I just want to go through a few of the sort of defining principles and practices of CBPR. So first of all, you have sort of, and how we might contrast them with more conventional clinical or health services research. So first of all, we have a problem, a research question, and conventional research that's defined by the researcher. In CBPR, this is collaboratively defined. So what this often means is that funding has to be obtained before we even know what the research question is going to be. This is a challenge of CBPR. And so the problem really often attends to multiple determinants of health in this approach. So the role of community members, similarly, as I said, rather than merely being research subjects, they are co-owners and decision makers. And this means there's often a long-term relationship with researchers. And control over knowledge production is also shifting away from total researcher control toward a shared control. And this means that community collaborators are involved in almost all aspects of research in a CBPR project. And then in terms of measurement, conventional research has emphasized measurement as a gold standard, although we see qualitative methods gaining traction. And CBPR, though, has long included and really depended on qualitative approaches, including maybe approaches that are less common in medical research, such as storytelling, the use of art, and such as photo voice, so which is photographic storytelling. So CBPR, as I said, really relies on coalitions. Here's an example of a CBPR project led by a physician at UCSF, Tang Nguyen, who's a longtime CBPR practitioner. And this project actually involved a very complex coalition of multiple community-based organizations, as well as researchers. And they even actually vetted some CBOs, and some were not even allowed to join the coalition because there were a lot that wanted to. And so this project really emphasized the importance of financial support for planning, because getting these coalitions up and running takes a lot of time. Another consideration in CBPR is resource sharing. This can be challenging on just an interpersonal as well as institutional level. And this is a very helpful article that talks about how do you actually get there? How do you share funding in a way that is satisfying to all partners? And they talk a lot about memoranda of understanding as a key tool in CBPR. And this quote here says, although MOUs do not eliminate all inequalities, they do help codify roles and expectations, promote accountability and trust, and as such, minimize conflict. Also important in CBPR and other forms of community engagement are negotiating different languages and ways of knowing. So we all know that we have disciplinary ways of talking and thinking, and researchers and folks who don't do research also find that there are real differences. This example that I have here, I love this. This is from a community-based project in Nepal, and the author of this article is an anthropologist who does a lot of work using art in community engaged research. And she asked the participants to draw their experiences interacting with the researchers. And this picture here is one participant's rendition of her interactions with two researchers. And this is a quote from the participant describing this picture. She says, "The two faces at the corner symbolize the two scientists we interacted with at Baton Hospital. The lady figure at the bottom is Dr. R. The white and black background around her represents her study. She shared all her results and outcomes. These are illustrated in white. But she did not have answers to some questions. She was really honest and clear about this. This is illustrated in black. So the sort of white and black triangles. Dr. B, on the other hand, discussed research methods. As shown in the doodle, it was a little confusing to me. I just think this is brilliant and says so much without words. And I think it speaks to the real importance of finding a common language in community engaged research. So also important, I think, in CBPR, but also in other approaches has to do with study design. And we all know that in medical research, randomized control trials are considered the gold standard methodologically. And a question I have for all of you is CBPR compatible with randomized controlled trials? It's certainly been done. And I guess that my question is, can we do this? Does this make sense? CBPR is a very emergent process that it has strong attention to context and adaptation and tailoring. And RCTs are very much about standardization and control. So I guess my sense is that participatory inquiries such as CBPR is really sort of epistemologically shifting us a little bit away from the focus on obtaining objective facts, decontextualized facts. That's not what RCTs are for. So this article that I have posted here is really sort of grappling with this question, like when we're doing community level interventions, studying them with RCTs, how do we ensure contextually relevant knowledge? So they say a critical need exists to develop new ways of building evidence that reflect the complex social systems involved when conducting community interventions. This development involves challenging some of the basic assumptions of current mainstream scientific paradigms and building on a set of assumptions that fits with the nature of these emergent questions. So I hope we can talk about this later. But before I move on, I want to put a plug in for Michael Duke's really wonderful book chapter on community-based participatory research that recently out. It's just a wonderful exploration of the history, principles, and practices in CBPR. I want to pause because I know there are some chats. I don't know if anybody wants to interject a question at this point. I'm going to go on and talk about community advisory boards, but I'll just pause briefly. Okay, I'll continue. So community advisory boards. Now, I just want to first point out that community advisory boards are often used and essential to CBPR projects, but they're not limited to CBPR. So community advisory boards are simply, and they're also called councils, committees, they have a lot of different names. They are a group of representatives, people who stand as liaisons or gatekeepers between communities and researchers. So their goal is to contribute their own professional and or personal experience to a research project. And they're often involved in various aspects of the research, but not necessarily all aspects as in CBPR. So I have here an image of the California Preterm Birth Initiative Community Advisory Board. And I also want to highlight that there are both research and institutional CABS. And I'll talk a little bit about the distinction in a moment. So some of the advantages of CABS are that they are a good way to incorporate community views. It's not as intensive time and resource intensive as CBPR in terms of developing coalitions and collaborations. Forming a CAB can be more straightforward, and it can help reduce the potential for exploitation of community members by having these gatekeepers. I think some of the drawbacks or challenges of CABS is that they often lack power to have a strong influence on study design or research. They may be in a more consultative role. There can be some overrepresentation by certain groups with particular agendas. And what this essentially means is that CABS can become professionalized, so some of the same people serve on multiple CABS. And I think this is partly because CABS rely on either paid or unpaid volunteers who really have many competing demands on their time. And it can result in consultation fatigue. So I think this is a problem because I've noticed that more and more researchers feel obliged to or want to form a CAB to help them in their research project. And there just simply often aren't enough people out there who can and are interested in serving on a CAB. So this is a dilemma that I think maybe we could talk about. How do we help researchers without every single research project forming its own CAB? So a couple of examples of research CABs. Here's one that I'm familiar with because it's in my field. This is a project focused on a gene called APOL1, which is linked to a high risk of kidney failure among adults with hypertension. Is particularly prevalent in people of African ancestry. So this project actually drew on an existing community academic research board that advises translational research at an academic medical center. And they formed a subcommittee to advise this particular project. And they were grappling with the complex sort of intersection of race, racism, ancestry, and genomics. And they, and this, I should say, this article was written by the board alongside some of the researchers. And they said that they found it very difficult to develop a shared language. And this was partly because they were dealing with genomics, which is a very technical field with a lot of jargon. They said that they encouraged the researchers to cede control over the conversation and challenge their views about race, racism, and ancestry. They concluded that as community advocates, we have changed the study design to optimize recruitment, retention, and patient understanding. So this is their summary argument that community voices actually can have an impact on the conduct of research. A sort of maybe less positive example is from Simwinga and colleagues in a study of 2 research projects in Zambia that use community advisory boards. And they kind of looked under the hood of what was happening with these boards. They found some nuances and imbalances in actual community participation and representation. And they said, owing to the researchers' monopoly of scientific knowledge, literacy, and financial resources, power relations were imbalanced. Researchers were quick to ask for and formalize community commitment through the CABs, whilst reticent about their own accountability to the community. But they did, counter this by saying CABs had subtle powers arising from their wider influence in community, which they could tap into to either support or resist research. So the upshot here is that CABs are very, it's a nuanced relationship. Now I want to talk a little bit about institutional CABs, which are different. These are CABs that are more long-standing. They don't just simply advise one research project, but they may be sponsored by an institution and available to provide consultation to specific projects. So an example at UCSF is the COVID-19 Patient and Community Advisory Board, or PCAB, that was launched early in the pandemic with institutional support and sponsored by our Clinical and Translational Science Institute. So I actually consulted with this PCAB about 1 year ago. And they have an array of what they call stakeholders. That includes patients, clinicians, community-based organization leaders, leaders of civic agencies, and other groups. So it's quite a diverse organization, and they offer input on various aspects of research. So we came to them before we even submitted a proposal, asking what they thought about our idea. And we talked to them for an hour. We were required to submit a plain language summary of our project. And then we spent an hour talking to CAB members and getting their feedback. It was very helpful. So there are many other examples of institutional CABs that we can talk about, but I'm going to move ahead and just discuss some of the broad challenges in community engaged research. I think that one of the most obvious that comes up is how to engage communities, how to gain entree and trust. In the pandemic, how do we shift to online engagement with research participants, with virtual communities? This raises questions about digital equity. But I think a less commonly focused on question is how to engage researchers. So this article that I mentioned earlier by Sara Ackerman in Nepal really addresses this question in a very interesting way. And she says that both the funders and the researchers themselves indicated that they wanted engagement, but institutional funder and disciplinary reward systems discouraged involvement. So essentially what she's saying is that researchers kind of unaware were doing these sort of tacit cost benefit analyses and decided it just really there wasn't enough inducement to participate in community engagement. So I think this speaks to broader problems with alignment of academic health center structures and policies and the goals of community engagement. So accounting practices and indirect funding policies make it really hard to do resource sharing. Promotion pathways don't always reward this kind of work. They focus largely on obtaining funding and publishing peer-reviewed articles. And then institutional review boards often also see researchers and participants in very, very discrete categories, don't always understand the kind of work that is involved in CBPR. So I think while shared power may be an ideal, something we all strive for, or the pod at the end of the engagement continuum rainbow, achieving it involves far more than simply overcoming the community distrust or the differences in epistemology and discipline that we encounter in this kind of work. So if we assume that more engagement is better, but it comes across structural constraints and incentives, this is a kind of clash here, then what does this mean? And this study actually delved right into this question. They looked at 25 projects calling themselves CBPR, and they found that a good number of them actually did not involve community members in most of the research components. So they even found that even though it did have some community participation, they had more of a traditional research-driven approach. So this is a quote from an academic community liaison who said, "The core leaders make the decisions, the CAB and executive advisory board facilitate those decisions." So I guess the question this raises then, does this result in top-down research just labeled as participatory? Are we ending up with window dressing and tokenism here because everyone feels they're supposed to be doing CBPR type work? So I don't want to leave you with a dour message here. So I do want to just highlight there are many other kinds of community engagement approaches that I didn't have time to talk about. I want to show you a few of them here. One is citizen science, and I recommend taking a look at the patient-led research collaborative, which is doing work on long COVID. And there's also deliberative democracy, collective impact, and human-centered design. And I want to wrap up by sharing a very brief overview of a human-centered design kind of inspired project that I'm involved in right now. And human-centered design is essentially a deep exploration of lived experience in order to develop more sort of relevant services and sometimes products as well. So one of the genomics projects I'm involved in, we have a kind of a sub-study called sharing aggregate results. Aggregate results mean synthesized information or conclusions about groups of participants rather than individual genetic information. The goal of our study is to collaboratively develop and share ethnographic and genomic research findings with participants. We're animated by the principle of reciprocity, and also that our participants told us they wanted to know what we were learning. Our collaborators are parents with a child who has a suspected genetic condition who are participating in genomics research, an artist who's also a clinician, a health communicator, and an ethnographic team. So our families are for the most part, low income, living in socioeconomic precarity. They have a child with special needs, which takes a lot of time and energy. They speak multiple languages, are in multiple locations around California, and they have limited internet access and time. So engagement is hard. It's very hard with them. And so we've taken the approach that we could take with this. So we've been drawing on themes from our ethnographic study, which includes clinic observations and longitudinal interviews. And we've been developing a visual story and a set of infographics with more quantitative data based on our findings. We're consulting with families as we develop the story in a series of interviews, showing them what we have, asking them for feedback, and making revisions to the story. Our goal is for it to be relatable and to help families feel somewhat less alone in their struggle that many of them describe to us. So we're currently at the consultation phase. We're developing a storyboard, and we will eventually distribute this to families and evaluate their reactions. So this is I think an example of much less engagement, but maybe more alignment with the capacity of our participants to engage with us. So I want to stop here and say thank you, and hopefully we have some time for discussion now. So I'm going to stop sharing my screen.
Wow, Sarah, that was fantastic. Thank you so much.
Thanks, Kim.
Yeah.
There's a lot, I asked a lot of questions along the way. So there's a lot to talk about.
There's a lot to talk about.
Yeah.
And I do want to open it up to questions. I see there's some comments in the chat. One thing I will just say that I'm personally interested in having you come back to talk to us about deliberative democracy, which I know it's varsity level community engagement. And I know that today's talk is really just broader perspective and on community engagement, generally speaking, but deliberative democracy is something that I've heard you talk about, and I'm really interested in that. But today you're here to tell us about CBPR and the use of
I'd love to come back
CABS.
and talk about it. I'm feeling a little disgruntled at the moment because we tried to get funding to do COVID-19 deliberative democracy events and failed 3 times. So it's hard to get it funded. Let's just put it that way. And it's hard to set up. But fingers crossed. Yeah, thanks, Kim. You know, I see Bob Hyatt's hand up.
Yeah, hi Sarah. Great,
Hi,
great talk. And I especially liked all the different references. I tried to write them down as quick as I could. One of the things,
need a list.
yeah, that'd be great. One of the things I wanted to ask you about was that last slide, collective impact.
Mm-hmm.
So I've used that term for some of the work I do, but I'm afraid I'm not being very good about accuracy in my understanding of it, because I've always sort of thought of collective impact as an effort to get different, I wouldn't even call them stakeholders. They're sort of different power sources within a community to work together for common good. And so I wondered whether that particular type of involvement is also one where community voices are just as critical as the other areas that you're talking about, or is it something where it's more of a an effort to get you know, organizations working on the same page and then approaching it with a community participatory research? So I just would like your thoughts about that particular nomenclature, I guess, that's used for collective impact.
Well, so yeah, I think there's, like a lot of this world of community engagement, there are terms that mean different things to different people. But there's a sort of field of research on collective impact. There are some publications on it I can point you to. There are actual collective impact projects at UCSF. So Laura Schmidt and the folks with the CTSI Community Engagement Corps, Paula Fleischer and those people, have actually worked on local policy issues around sort of alcohol availability, though you may have heard of some of those. So yes, my understanding is that your second explanation, I think that's the one where you're talking about, you have organizations and you have what they call a backbone organization, which is often the academic medical center, but it doesn't have to be. It could be a public health department. That's the organization that kind of does the coordinating. And then you have other organizations that have maybe the same goal, but have not worked together. So the idea is there are all these different groups trying to work on the same problem, but they're not coming together and creating a strong coalition to get things done. And I think this is at the core of collective impact, is like, let's pool our goals and resources to make some policy change happen. And I think it's often oriented toward policy. So that's my understanding of it.
Yeah, okay, good. That's compatible. I would like to see whatever other references you got. We think that the San Francisco Cancer Initiative is using collective impact too, so.
Oh, I have a bunch of references I can add to the, I'll put this list together, but I'll add a few on that I use in my course, because we have a module on this. So yeah, great. Thanks. I think Michael's hand maybe was up next, but I'm not totally sure because there's a few hands.
Michael.
I think Deepa was ahead of me, actually.
Oh, is Deepa?
Oh, Deepa.
Hi, Deepa.
Hi, thanks so much for that talk. That was great. I actually have a question that's kind of, I want to say like maybe a little bit of a big picture question, but also a little bit specific. Just in context, sort of for a lot of the reasons that I think you were describing in terms of the challenges of doing CBPR, CBPAR, if you're working within a project that kind of has a bit more structure and doesn't have the flexibility to start sort of engaging with the community from those design stages, like, are there ways that you can sort of responsibly and like appropriately engage with the community without like putting that label on it as being CBPR, you know, like artificially, if that makes sense? I guess I'm wondering how to sort of approach doing community engagement in a context where it's not super easy to do it.
Yeah, that's a great question, Deepa, and I'd love to hear what others think about this, because I think there's an argument that there's been a watering down of CBPR. Everybody wants to call everything they do CBPR because that seems to be the gold standard. At the same time, I think that not all projects are amenable to that kind of intense long-term relationship building, that it's expensive, it's time consuming, and it doesn't mean that you're not doing community engagement if you can't involve stakeholders at every single level of your project. So I want to pause, and there are some people who know a lot more about CBPR than I do on this call, like such as Michael, and I'd love to hear what you all think about this, because I just think that we have a labeling problem to a certain extent, that there's plenty of wonderful approaches, but they're not necessarily CBPR. Michael, since your hand was raised and you're a CBPR expert, I would love to hear what you think about this.
I don't know if I'm expert, but you're right. I mean, I think that there is kind of a continuum, and there's an assumption that the continuum, by talking about a continua, it means that we're talking about watering down something. But I think you're absolutely right. I mean, like, different projects just have different requirements, in the same way that different projects require different methodologies, right? That you use the tools that are most amenable to that study, and that I think that's equally the case, or maybe even more the case with CBPR and community engagement, right? I mean, bench science, much of bench science doesn't need to have community participation much at all, not necessarily, depending on what the research questions are. Whereas others, it's critically important. And so, I think the last thing we want is to turn into kind of a religion, right? Like, where there's like a fundamentalism around CBPR.
Yeah.
But the thing I wanted to bring up was a little bit different. You had mentioned kind of institutional impediments or constraints on CBPR, which I think is really important. I mean, especially, to be honest, around issues of like tenure, right? I mean, like, the institution where I worked before in our program, community engagement was actually required as part of our tenure portfolio, right? And I served on a committee to try to have that scaled up university-wide, where every department in this university, whether you're in engineering, sociology, whatever, people had to do some kind of community engaged research. It didn't have to be CBPR, but some kind of way in which communities were involved in the research. And when I left, and we were moving forward at a pretty good clip, and there was a lot of support around that. There was this kind of field called engaged scholarship, which mostly like land grant institutions, like the one I used to work at, to serve first generation college students, et cetera. There seems to be like this really interesting kind of set of questions around, universities in low-income neighborhoods, like that they need to be part of the community, et cetera. But it feels like, especially in R1 institutions, I mean, like the time commitment to build community relationships is time that's taken away from your publications, and is time that's taken away from writing grants and the things that are measured in tenure. And so it feels like in order for there to be a substantive change, I mean, there just needs to be a different perspective on what constitutes scientific knowledge and scientific knowledge production.
Yeah, absolutely. Thank you. Absolutely agree with that. And I think there may be a subtle shift happening here. I mean, I definitely have noticed over the last few years that my students are not in as much despair about the conflict between what they're expected to do, what they want, what they think is important to do, but it's still there, right? The bottom line is still, you have to bring funding in, you have to publish. So there is a tension there that is unavoidable at the moment that we have to acknowledge. And then, yeah, to your point about this idea of a continuum, I think it's more important to answer Deepa's question, I think it's more important to be honest about what you're doing and the challenges you encounter along the way, and what kind of collaboration you're actually engaged in, rather than trying to sort of paint yourself into the CVPR picture and convince everyone that's what you're doing, when that's not what you're doing. I think that's a discrediting, and it's a problematic situation, almost like an arms race that I hope that we can avoid. So I think Sarah, you have your hand up. Sarah Mars.
Thanks. That was a fantastic talk, Sarah. Really great. So my question is, if your research, like mine, is among people who have very chaotic lives, like people who are active injecting drug users, I mean, if you're doing really long-term ethnography, you could probably build up relationships and find someone who is a cluster of people who are, have more structured lives and are able to engage in a project over a period of time and maybe come to meetings and so on. But if you're doing short-term research among people who are, maybe mostly living homeless and living hand to mouth, and their main concern is their next opioid dose and so on, they're not necessarily going to be very easy to engage in a community research project. Do you have any thoughts on how to involve people whose lives are very chaotic like that, or whether you need to just go around about it in a completely different way?
Well, I know there are people on this call who do work with these kinds of populations, and I hate to put Michael on the spot again, but Michael actually has done a lot of engaged research with people experiencing homelessness, and so probably has something to say about this. And I know there are others working with populations, the others on this call working with populations that are more difficult to engage. So I'm gonna actually see if there's anybody on the call who wants to try to answer your question.
Thanks.
Well, I'll just jump in before Michael and maybe Deepa to say that, Deepa is working with a population that is also potentially disadvantaged in their ability to participate in the ways that Sarah may have just depicted. How do we engage with communities, and how do we get them to participate in all aspects of our research? But so I'll just echo Michael's point that, you select the tool and the method and the approach that works best for the population that you're trying to serve with your research. And I think you find the creative ways to engage with people and work with what they need and how they want to participate, instead of imposing this idea that we have to involve people from the very beginning through the end, including having them become data collectors and interpreters for us. take a more harm reduction approach, just to use that nomenclature to say meet them where they're at in terms of how do they want to show up in the research? Do they want to show up in the research?
Yeah, I suppose I'd love to hear any creative ideas about doing that. Yeah.
Anna Franco puts in the chat that photo voice could be one helpful approach, and there's a link here, Sarah, that you might want to take a look at.
Oh, thanks.
And I think in my case, maybe my perspective is it's formed because I do kind of policy research, and so that's a little bit of a different animal in some ways. And I'm an ethnographer, right? And so, I mean, I totally agree with what both Kim and Sarah were saying, that, again, this idea that not everybody needs to participate fully in every aspect of the study design, et cetera. But like, for example, in the work that we do, is especially qualitatively, and because we're doing the work that we do tends to have a policy focus, we just ask people, like in the course of doing an interview or whatever, it's like, here are the kind of issues that it seems like that they have to grapple with. Like, what should policymakers know about this topic from your experience that they're just not getting, that kind of thing. And so in some ways that's a minimal amount of effort on their part, but it can have tremendous impact in terms of so I mean, that the person didn't necessarily participate in the design of that project, but that impact can be really powerful, right? I mean, because we can take that really important information and their words, to policymakers in a way that could actually have benefits for that community.
Such a great point, Michael. I mean, I think for many projects, just adding qualitative methods, it can be transformative, because like you said, you're actually giving voice to the people who matter for this project and incorporating what they know and possibly changing what you're doing because that you've learned from them. This is, allowing for more emergence, I think is key. So that may be a form that we can call that a form of engagement, right? If your project previously did not include any qualitative exploration. So yeah, so Deepa, I'm curious, like, do you have any thoughts? Because the population that you work with is very similar to what Sarah is asking about.
Yeah, and I want to say a lot of what we've learned about engaging with this population has been thanks to Michael. So we really appreciate the insights that you shared with us in the past, Michael. But I will say that what's been interesting now that we've kind of been doing a lot of the qualitative interviews and whatnot, and have had a chance to interact with some folks with lived experience and some various like community stakeholder types of groups. I think the feedback that we're getting is very different across these different groups. I think some in the interviews itself with clients of the street crisis response team, I think what we're finding is we're trying to create a space to kind of allow folks to be honest with us about their experience and sort of what you were saying, Michael, with like trying to create opportunities for feedback and allowing that sort of flow of information. And I think what a lot we've been hearing in those interviews has been like appreciation for being able to tell their story and having someone listen to what they've experienced and kind of just someone caring, and I think what's been different about some of the stakeholder groups that we've been talking about or talking with has been a very different response. And I think that's also valid. And right now, I think what we're trying to do is figure out how to sort of balance these different types of feedback and like flavors of feedback that we're getting. So I think a lot of the stakeholder groups are sort of asking questions about the program, like at a very high level and kind of like, why are we funding this when we should be funding XYZ, so some more of like the sort of structural pushback against a program like this and whatnot. So yeah, I don't know how helpful that is, but that's kind of been the insights that we've been working with so far.
Thanks. Yeah, I mean, I do find in the course of the research, often it's all qualitative research that I do, that often people do feel heard just through having been interviewed, like you're saying, Michael, and you know, sometimes we will ask them other services they would like to see, or other things that we haven't asked about that you'd like to tell us about, and so on, and so we do feel we're kind of like representing these voices that aren't usually heard, but just occasionally, like you'll go to a community like West Virginia where people have like a history of kind of extraction from their community, exploitative extraction, and then you feel, you know, maybe a bit more like you're going in, you're taking something, you've got this grant money, and they're not maybe feeling the benefit as much as they feel they ought to because of their own particular history of mining and environmental destruction and so on and so on. And it just made me think a bit more about how to involve, you know, how to help them really, essentially.
Yeah, thanks, Sarah. I mean, I think you're highlighting a quandary that researchers generally face, which is, what is our ethical obligation to address just the everyday needs that participants have? This comes up a lot in global health, but of course it does here as well. It's not an easy answer to that question. But something we need to ask ourselves and talk about, I think.
I think at minimum, I always encourage teams to very early on consider how they want to report back to the community, what kind of formats are going to work best. So I love the illustration that you provided with your the share project, I think, is that what it's called, share?
Mm-hmm.
Yeah, I really like that. But just at minimum, during interviews, asking people, A, do they want to know about the study results? And can they tell you what would be the best way to contact them in the future? And I know, Sarah, the population that you're working with, and same with you, Deepa, it can be really challenging. It's not like you're going to email them an infographic with your findings. Some projects can do that. So wherever you can reach people later on to share what you learned, at minimum, we really do need to do that. But you have to plan for it. You have to think about it, and you have to build it into your IRB so that you can recontact people. So some suggestions.
Yeah, those are great suggestions, Kim, thanks. Bob asked in the chat, what have been my biggest challenges in teaching the course? Well, I think the first one is just too many different fascinating community engagement approaches and not enough time to cover them all in depth, right? I mean, there are things like collective impact, and you could spend the whole quarter on that. You could talk about citizen science for a whole quarter. So how do we actually introduce these ideas without being too superficial?